I'm going to go ahead and kick us off. Thanks for joining, everybody. This meeting is informational meeting today is about our specific call for research proposals that CareQuest Institute is engaging in over the last little bit of the year. The purpose of this meeting is to give you information on what's in the RFP. Those links are also available in the chat. You'll be hearing from various members of the Analytics and Data Insights team as part of CareQuest Institute, who you may be interacting with if you are as you are submitting and hopefully receiving this award. My name is Eric Tranby. I'm the Senior Director of Analytics and Data Insights here at CareQuest Institute for Oral Health. I will let my colleagues introduce themselves as we take turns speaking. There's a Q&A, just a couple quick notes. This session is being recorded. We will post this recording online, so you'll be able to refer back to it. There is also if you have questions that you think of as we are talking, there's a question and answer box that you can click on and ask your questions. That's the best place for you to ask the questions because they're sorted in that, because they help us kind of see and sort those questions. There will also be an open Q&A session where you can take yourself off mute and ask the question directly at the end of this call. The intention of the call is to make sure that you come out of it with a clear understanding of what this RFP is, the kind of research we are interested in sponsoring, who is eligible for it, and the kind of data we have. So please ask questions along the way, and I'm kind of seeing those roll in. So thank you very much. All right, I will get us kicked off here. As I said, I'm Eric Tranby, Senior Director of Analytics and Data Insights. I've got some of my colleagues joining me, and we are pleased to announce our call for research proposals where we'll be funding additional research, external researchers to access our data and use that information for publications, presentations, etc. CareQuest Institute is a national nonprofit where we operate as a catalyst for systems change to bring forth ideas and solutions to create a more accessible, equitable, and integrated system for all. A lot of ways in which we do that work: philanthropy, our analytics, data insights team, education, policy advocacy that you can list off here. Importantly for this call, we don't do it alone. Our mission is to build capacity through partnerships with researchers and advocates and stakeholders such as yourselves to improve the oral health of all. Our team, in particular, Analytics and Data Insights team, we're continue to grow. We'll have 17 in total 17 members of our team by the end of the year. That uses our extensive database, of which you'll see some examples of that database here in the call, as well as our analytic abilities to drive actual insights to lead to improved and equitable whole health outcomes and total cost of care through more integrated and accessible oral and medical and social data. We do this through a variety of mechanisms. We publish our own research. We publish data products and dashboards that can be used by advocates, and we partner with researchers like yourselves to conduct research studies and develop new data that will help us drive systems change. The opportunity today is that we are awarding a series of awards for you as researchers to access our database and conduct a study and publish and present off that study. I'll pass to my colleague Hannah to give more details on the awards and keep those questions rolling in. Thank you.
Thank you, Eric. Hello, everyone. My name is Hannah Chung. I'm the Health Science Specialist on the Analytics and Data Insights team. I'll be speaking to kind of the background, the purpose of the RFP. So the goal of this RFP is to invite early career researchers to apply to utilize CareQuest Institute's data resources, completing a research analysis project that will culminate into a peer-reviewed journal submission that is in alignment with our mission at CareQuest Institute. And that mission is to improve the oral health for all by creating a system that is accessible, equitable, and integrated. So alignment to CareQuest mission is essential in this RFP. The funding availability is up to $50,000 per award for direct and indirect costs, and the facilities and administration costs are capped at 15%. So research focus areas that we are looking for, these are a few examples, which would be population oral health research through surveillance data and metrics. Other examples are integration of medical and dental systems to improve and transform healthcare, research that revolutionizes the health system to integrate oral health into overall health, ways to understand different factors that influence oral health equity for underserved populations, and research that focuses on promoting public policies to increase oral health care access and affordability. So these are just some of the research focus areas that we're looking for. As you apply and as we review, we are interested in seeing what you all propose. And with that, I will pass it off to my colleague, Dr. Lisa Heaton, to talk about the eligibility criteria.
Pardon me. Thank you so much, Hannah. My name is Lisa Heaton. I'm the science writer for the Analytics and Data Insights team here at CareQuest Institute. And I'll be going over some of the nuts and bolts as far as the eligibility criteria and the how we're going to evaluate these proposals. So we are generally following the NIH definition of early stage or early career research investigator. So there are two parts to that. One is having completed a terminal research degree or postgraduate clinical training within the past 10 years, and having not previously successfully competed for an NIH R01 grant. I know NIH talks about substantial grants, and so there's a lot of different grants that NIH offers. We're just limiting it to if you have not served as a PI or successfully competed for an R01 grant. That's how we're defining that piece of early stage investigator. It's open to individuals who are employed as a full-time research or teaching staff at a US-based accredited university, and somebody who has a promising track record of conducting analyses and peer-reviewed publications. We know that we're talking to people who are early stage career investigators. So we're not expecting, a 75 peer-reviewed publications, but, a promising track record of doing these analyses and publishing in peer-reviewed journals. Also having the expertise and the technology available to work with these data sets and to report on these large data sets. And we'll also go over project timelines here in a couple of minutes. So the ability to meet project deadlines. So if you know that in the next couple of years you have, an enormous workload ahead of you and you might not be able to meet those project deadlines, that's something to think about as you're thinking about the applying for one of these grants. So let's see, let me click on the next one. So the proposal requirements that generally going to follow the NIH SF 424 format. We're looking for that everything but the budget and justification to be 3 pages. So the proposal itself being 3 pages and then 1 page for the budget. Again, the sections of the grant are going to follow the NIH format. So specific aims, significance, innovation, approach, how you're going to do the work, the resources environment that you have to do the work, the personnel that are going to be involved, and again, a page for the budget and justification. And all of these are described in a little more detail in the RFP, and we're happy to answer any questions about that as well. So proposals are going to be judged, evaluated on these criteria, along with the alignment with the CareQuest Institute strategies and focus areas that Hannah just went over. And we're generally going to be following the scoring rubric laid out by NIH, where 1 is exceptional, and then it goes down from there. So I will now hand it over to my colleague Adriana to talk about available data resources.
Thank you, Lisa. Hi, my name is Adriana Sonic. I'm the manager of the health informatics team here at CareQuest. So my team would be working with grantees to provision data. So we have really rich data sources and a very broad summary is that we have an integrated medical and dental claims data set that includes over 39 million patients and almost 5 billion claims. That includes Medicaid and commercial claims, as well as other sources of data. We also have a specific dental claims data set, which includes 35 million patients and 930 million claims. That includes Medicaid and commercial claims, as well as EHR extraction. We also have the healthcare cost and utilization project claims data, so the HCUP data, specifically the emergency department data. We have that at a national and state level, so we can look at state level trends. As well as that, we, on an annual basis, do the State of Oral Health Equity in America survey. So we have done that from 2021 to the most recent year. And the yearly sample size ranges between 5,000 and 9,000 patients. So with that, I'll hand it back to Eric.
Thanks, Adriana. In terms of timelines, proposals opened last week. We've got the informational meeting today. The proposal deadline is September 5th, 2025, so a little less than a month from now on a Friday by 5 p.m. Eastern time. You'll send your proposals in either Word or PDF format to the inbox at the bottom here, analytics@carequest.org. From there, we'll be doing rankings and reviews. We may come back to answer questions, etc. But those awards will be announced at the end of October. There will be some additional process that we need to go through in the last part of the year. I will talk about in just a second if you are awarded. From there, we will look for analysis plans due. So this would be the point in which you'd be interacting directly with Adriana and our data products team, as well as other folks within the team to really understand what's in the data, get a clear data plan and analytical plan in place so that we can provide that data to you. To analyze in a robust, kind of robust fashion. You'll have some time to go back and then analyze that data, ask questions, go back and forth a little bit. Draft manuscripts then are due for our review by the end of 2026. We would anticipate that 27 will be spent working to get manuscripts published or presenting the results of those from the analysis at conferences, etc. Here, so that's a little bit more on the timeline. I would be remiss if I didn't thank our board of directors, our executive leadership team, and our philanthropy team, who has extended out their grants funding for 2025 to fund these grants. Again, there are the 5 grants up to $50,000. If you are to receive one of these grants, they will be administered through our grants process. So once they are awarded, there will be some work to do to enter those grants in flux. Those particular programs in flux, and our grants team will be part of the awarding process. It will be part of the kind of review and awarding process in collaboration with our team. We anticipate that those grants will run over 2 years, with those $50,000 being awarded fully in the first year of the grant, and the second year being pre-approved no cost extension. When you have some concerns about that, that's we can have those conversations about how to distribute the money. But at minimum, we anticipate that these grants will run 2 years, with the bulk of the payment being in the first year, but some ongoing work in terms of publication, presentations, etc., happening in the second year of the grant. With that kind of completes our the kind of formal part, I guess, of the presentations today. Any additional questions? I'm kind of seeing some in Q&A. We'll go ahead and answer live right now, and then we'll open it up for folks to answer questions as well. If you have questions after the call, you could submit them to the analytics inbox directly to myself at etrainby@carequest.org, or to our program manager as well. Best to email both of us, who will disseminate those as well. Jasmine, if you could take the slides down, and we will answer some of the questions here that have that have come through. So first, I'm going to do the Q&As that are in chat. So those might answer your questions, and then we'll turn to some of the live, I guess, or kind of in-person questions. Let's see here. Kind of scrolling through the order, I get them. So Oscar asked, what about a full-time faculty member from an accredited pediatric dental residency program, stand-alone program not affiliated with a university? Yes, those folks are eligible to apply. That's a use case that we didn't think about, but is perfectly appropriate for application. Aaron asked about radiographs or teeth present data from an EHR extract. We do not have access to radiographs within our work or these data resources, but we do have information on the teeth that are present extracted, typical exam or EHR data that we would be able to share. So radiographs, no. Teeth present data, yes, we have. Megan asked what years are available for the claims data. Adriana, do you want to weigh in on that?
Yes, so for our integrated medical and dental, we have approximately 10 years of data. For the dental, the previous 5 years is available. And the survey is 5 years.
Thank you. Hey, Juan, good to see you on the call. Good to see your name. The pop-up here, affiliation, full-time, part-time adjunct is, we are more interested in the researcher than necessarily how they're defined connected to their university. So any affiliation is appropriate. And a last year PhD student could apply with a team as long as they're a named faculty, kind of a listed faculty advisor who would be supporting the grant. Sarah asks, are researchers independent research institutions eligible? It probably would depend on the research institution. So it might be a good question to come off mute and ask about, yes, they are, but there may be some complications here depending on if you guys have received grants in the past, et cetera. Melissa asks about pre-award departments at a university. Have we had issues with that in the past? What we would, Melissa, that's a great point. I'm not sure. Some universities are much more, they care if you get the award. Others, I know that there is some process that they want to go through. What we would ask is that you share your intention to apply for the award, that you share with us the proposal by that September 5th, and do indicate that your university is still reviewing that you are still reviewing, and your university would have to confirm that you have that university still has to review, et cetera, before we are to award. If there is an extra need, if there is an additional need to wait longer, please do let us know and reach out there. Not abstaining, I'm not sure on the question there. So we'll pop off mute and ask. So HIA data have zip code. Unfortunately, it does not. We have state, but we don't, and metro areas, but not zip code. Adriana, let me know if I'm wrong there.
You're correct.
Claims data national or some specific regions. The integrated claims data is national. There is some geographic information there. But the expectation would be the best way to think about this is more as national level studies. There may be a possibility to compare, state or local levels. Please ask those questions via email, and we can confirm one way or the other. Postdocs are eligible eligible to apply. That is correct. Research nonprofit organization, not necessarily it's affiliated with university, is the next question. Yes, please. Please either please ask the question and directly give us some information about your affiliation via email, and we'll be able to answer. I see Megan here clarifying most recent year available. We have up to claims data generally 2023, and our survey data is as recent as 25. Lowest geographic level available on these data sets varies, but lowest geographic level available would be metro area, not down to zip code, pretty typically. There may be some within our that our dental claims data, zip code would be available, but we may need to mask for patient privacy rules. What we would do if you were looking for zip code information is link the zip code information that you were looking for. Proposal to collect data. So that's interesting. It's a concept I'd be open to receiving a concept on collecting new data. I do think that costs may quickly spiral on those, but I'd be happy to hear it. There's a question on data dictionaries available to see what questions could be answered. What I would, or what researchers would work with the data on the CareQuest platform. That is ideally be great to have all the data available publicly. Unfortunately, there are some restrictions that don't allow us to share the full dictionaries. What I would see with in public right now, we have descriptions available. If you have particular questions, please go and please ask us kind of directly. We could respond to those. Specific restrictions or limitations, what can be included in the project budget? No, there are no limitations on what can be included in the project budget. Although be aware that our grants team has a limitation of 15% on F&A or overhead. That is the current limitation. Data sets set up for longitudinal analysis. Yes. All the claims data sets are set up for longitudinal analysis. The SOHIA data or survey data is more of a panel design, not necessarily longitudinal in nature, but the claims data sets are there. Aaron asked about setting up a one-on-one meeting. I would ask that you submit your questions in an email, and if those are easier to answer via one-on-one meeting, we will go and set those up. Oh, there's not time enough to get the emails. The emails, Sonia, are listed in the RFP and online. So please click on the links above, and they will the links in the chat, and you'll be able to see those emails. Students can apply, but we need a faculty researcher, listed there as well for those questions. Small size of geographical region, metro areas, I would say, are the smallest size. County as well. There are questions. Well, lots of questions. I like these. Questions on budget include partnerships with other entities. Yes, they may. Again, no limit on what I'd like to see. Really creative stuff coming through. So no limits here outside of what I just talked about. You can combine data with other publicly available data sets. That is correct. Household income data, depending on the data source, but we generally have income data, yes. There was a question on Medicaid data versus Medicare data. We do not We do have, sorry, we don't have all Medicare data. There is some data on Medicare supplemental plans or duly eligible, but there is not any information available, but we don't have all Medicare data. Yes, the claims data we have. So as I asked about, our dental data include children 6 to 10 years old. Yes, the data covers the full age range of the claims. Integrated claims data and oral data does cover the full age range from 0 to death, to 100 plus. Our state of oral health equity, our survey data covers adults. If you, somebody asked if we have plan in place for dental work at a dentist's office, could grant pay for that work? This particular grant is meant to cover research. It does not cover clinical work. Our grants team, however, does do some work, does have some emergent and urgent relief fund that would might apply here. If somebody could post a link to our grants page in chat, that would be very helpful. I'm looking through the open questions in chat, and then we'll open this back up. So we talked about the data dictionaries, longitudinal tracking, as well. The questionnaire questionnaire for SOHIA could be made available. Yes. Dr. Nikhil just sent us an email with that request as well. We will send we can email the slides to everybody who took part. So yes, if you have those. There's a question on the amount of the awards, where each award will be, yes, each award will be $50,000, and we expect to do 5 awards this year as well. That answers that questions. There's a question about ICD codes on for those patients with disabilities. Yes, we do have ICD-10 codes in our Medicaid and commercial insurance data. There's a question on what provider type data is in the claims data, and yes, we have information on FQHCs in the data. And I think I've answered all the typed out questions. If there are other questions still remaining, or anything that I was not clear on, please feel free to take yourself off mute and ask the question. If you would like to raise your hand, and then I could call on you as well. Cherry Beth, I'm not sure how you say that first name. I'm sorry if I missed.
Yeah, that's fine. I was the one to ask about the public health because we work at the Michigan Public Health Institute, so we are technically not affiliated exactly with one university. We have had partners with different universities. So I was asking, how rigid is that qualification about being a research or a teaching assistant with the university? Because many of us are PhDs and masters level people, and we have worked a lot with claims data.
Yes. Has your organization kind of applied for grants in the past and have like a grants process?
Yeah, we have had NIH projects actually. Perfect. And CDC projects, HRSA.
Then yes, you would be eligible. The chief concern here that we want to make sure is that the organization understands how grant making works, and how the grant process works. It has some established procedures, etc. More of so yes, you would be eligible. Please go ahead and apply for the grant.
And related to that, because we have a different kind of a structure. I mean, we have staff that are junior level with masters, but we are senior people too. We have had a lot of experience. So can the PI be a master's level person? And we as the senior researchers, can be collaborating with our junior staff.
That is correct. So the part of the goal with these grants is that we elevate early career scholars who are at particular risk in this environment of having limited funding success. That's severe funding success with cuts in NIH or other forms of funding. So the intention of these grants is to help elevate those early career scholars, having more senior scholars surrounding those folks within their institution and helping work with them is only a positive in our view. So yes, that that is acceptable, and that would the intent of the grant is to support those early career scholars, both with our direct grant funding, and if there's a mentoring network around those folks, all the better.
Thank you.
I would also, I'm going to do this a little bit on the fly, but I will dig this up and post a chat, or we'll send an email. But CareQuest Institute is also supporting the American Association, the AAD OCR Mind the Future program. So our junior scholar or early career scholar mentoring program that was used to be funded by NIH is now being funded by CareQuest Institute. Applications for that is open as well. For early career scholars who are interested in applying, you are eligible to apply for both the mentoring program through IADR and our own direct grant. And it would be nice to kind of see those overlap. Let's see. Couple other questions I've seen pop up in chat that I can answer. Citizenship requirement? No, there is no citizenship requirement to receive this grant. The budget should be accounting for 1 year only, correct? The budget could shift, budget could kind of be over, yes, it'd be ideal if the budget gave 1 year. I'll just answer a question that way. We do understand that publication takes longer than 1 year. The second year would be more of a no-cost extension, but be planning and doing the bulk of the work within the next, from December 26, sorry, December 25 to December 26. Other questions? Sarah?
I have a question related to the criteria that you're using for defining early stage investigators. And I understand that that's the NIH definition, but I just wondered if there was any leeway around that first criterion about when the training was completed, because what if, someone is an applicant who has trained perhaps in another field and has transitioned into a different field that is aligned with the mission here, and that has only happened in the last few years. Would someone like that be eligible and still qualify as an early stage investigator?
So we have put some criteria around it because you need to define things. That does not mean that we've got to. That does not mean that there are always exceptions. That there are not exceptions. Sounds like this would be one of them. How you're describing it, I believe you would be eligible. I would recommend sending in, kind of documenting, who you are, who you're talking to in an email, so that we could confirm that, so that, we can kind of review and understand and then confirm applicability. But the intent of these grants is to support early career scholars, how broadly defined within that segment. The intent matters a lot more to us than the letter of the law, so to speak, in this case. So my recommendation, you send us an email, and we will kind of review it and give advice. But how you're describing it right now, I believe you would be eligible.
Okay, thank you. I'll send an email.
Sonia.
Yes, can you hear me?
Yeah.
I don't know why I don't have a video, but okay. I ask on the chat, I am Brazilian and we are willing to do a research in the New York Dental University. So if I'm not related to any university here, should I apply, or should someone from New York Dental University apply?
The latter, please. So this is intended to, so these are intended to support, broadly support US-based researchers at this time, given where we see with cuts in US federal funding. So the principal investigator should be associated with a US-based university.
So the US should apply.
Correct.
Yeah, okay. Thanks.
Thank you.
Thank you.
Other questions? These are great questions, and we've done this at least once, and I'm always amazed at the things you don't think of fully when you're writing these out. Thank you, Aaron, for posting the Mind the Future in the chat. I'll give it one more minute. Asa.
Hi, how are you guys? Thank you so much for a very informative presentation. So I looked over the qualifications or the eligibility for the Mind the Future, and they
Yes.
state very clearly that early stage career does exclude associate professor or clinical associate professor. I finished my degree less than 10 years ago, my terminal degree. So, but I am a clinical associate professor. So
Okay. So
how does this overlap for the application for the CareQuest?
Yeah, so for the CareQuest grant, that is not a requirement. There is no requirement that you are only assistant or otherwise. So you are free to go ahead and submit an application for the specific RFP here. The Mind the Future program has its own set of requirements, and so if you're not eligible for that, don't obviously don't pursue that one. My only intention with that statement was to be, if you are eligible to apply for both, I would recommend, it would be good to maybe get some commonality, across the two, but it's not but is certainly not a requirement, nor is your participation in Mind the Future going to increase your eligibility potential for this grant, or vice versa. You getting this grant.
Okay. Thank you so much. Yeah, that's clear. Thank you so much.
Oh, yeah.
Is there anything getting caught or bothering you?
Megan, say that again. I'm sorry.
That make it too long?
We're not able to hear you, I don't think, or there's background noise, Megan.
I'm a little bit lighter, but
I think somebody may be accidentally off mute. Jasmine? Thank you. Sonia again.
Sorry, but
No, you're fine.
I was trying to copy all the address on the internet because I was studying it yesterday, the Query Institute, and I was not finding the proposal for 25 that's here, but I cannot copy. Maybe could you send us by email this address?
Oh, the email address?
Yeah, the CareQuest Institute
Yes, we could get
proposal
that out. I'm not
2005.
sure. Yeah, I'm not sure why
But-
you're not seeing it, but
No, I'm seeing. I'm not able to copy. I copy and when I put in Word, it doesn't appear.
okay. So if your email, if you could drop it to chat or a Q&A, we could send you a separate email with the information.
Okay.
Thank you.
Okay.
All right. Let's see, a couple other questions. Dr. Shukla.
Yeah. Hi, Eric. My question is, are we able to merge any of the data sets in case, so like you said, you have the HCUP access as well, but if there is, so I wanted to see, and I'm not gonna say the whole proposal, but like if I wanted to see the association between some sort of claims, and then the HCUP is a possibility.
Yeah, so I understand the question. We can't merge the data on the patient level because there is not a common identifier across them, but could be merged down to a state level and potentially below that, depending on the particular data set that we looked at. So subgeographies could be merged as appropriate. If there are some restrictions on our ability to merge data sets because of potential re-identification concerns, but I would consider that you could look at things like state rates and compare those. Lower level geographies might run afoul of those. If you have a particular proposal that, a particular thing you want to merge together, email us, email a question and we can answer that, kind of more directly. But I would say we cannot merge on the individual patient level across these multiple databases.
Okay, thank you.
Jerry Beth.
Yeah, but you said you can do longitudinal studies, so there are unique identifiers, right?
Correct.
We can do
Yes.
that across the years.
Correct. No, that is correct. What we don't have is within each data set, there's a unique identifier for the patient or the individual. There is not a unique identifier across data sources.
And there are the claims, of course, the identifiers, unique identifiers with their specific claims, the procedures, and all of this. Okay, thank you.
Yes. So we're able to follow a patient within each data source over time and across kind of products or each encounter, each visit, we're able to link to other visits. What we are not able to do is say link a patient information from a claim that happens on the medical side to a fully separate data source outside there, like HCUP. Within our integrated data sources, we do have the full medical, dental, pharmacy history of patients following them over time. So we're able to make those connections across data sources. Or across different domains of receiving service. But like the data sources Adriana spoke to, we're not able to do cross-linkage across those at the patient level. Dr. Nikhil.
Yeah. Hi everyone, and thank you for the information. I just have a question regarding the State of Oral Health Equity in America survey. And so my question is is it a longitudinal data? And is it a longitudinal survey? And do we have the similar variables like each year from 21 to 25 so that we can assess the trends in the attitudes or, the experiences, the behaviors?
So we can do that. We could do the latter, and that is a repeated cross-sectional panel design. In other words, we ask many of the same questions year over year. While there are some individual consumers who respond to the survey multiple times, we haven't done extensive. So some longitudinal analysis may be feasible on the data. We can work with you on that. A more appropriate way of approaching that data, though, is that as a repeated cross-section design, where we ask the same questions, but and it's meant to be a statistical representation of adults in the United States, but it is not an exact panel design where we have the same people for 5, 6, 7 years.
Okay. And how do we get access to the questions for the proposal, just if we want to, plan out the variables, how do we get access?
we could share that particular code book a little bit more openly. There are some restrictions on some of the other data dictionary elements because there's potential PHI or vendors, etc. That we have to be concerned about. Please send an email requesting, for those of you who are looking at that SOHIA data in particular, please send a direct email requesting that data dictionary. We'll be able to send that out to you.
Okay. All right. Thank you so much.
Yeah, thank you.
Sonia.
Sonia again?
Yeah, yes, sorry. You said you have data, and that was the first question you already answered, but I would like to know if you have a certain data for a specific oral disease and data from the accessibility when they come, how much private system pay, how much the government pay, and can we have this data on different ethical groups, for instance?
I think I understand the question. So,
Yeah.
there are claims data. In other words, the answer to almost all your questions is yes. We have information on how much was paid. We have information on we have information on what the at least reported conditions were that diagnosis codes that were associated with their desire to seek treatment. We have so the answer broadly to all your questions is yes.
Okay, thanks very much. Thank you.
Sherry Beth.
Sorry, I can ask about the specific data. You did say that you have provider data, but to what extent are these identifiable, that specific providers? I mean, I'm actually thinking about FQHCs and all the innovations through the years. Is it possible to identify FQHCs, the extent of medical dental integration? Because some FQHCs have this and others don't have it. Or
Yeah,
are the providers based on are there NPIs in the data?
Yes. So there are NPIs in the data where you could link that information.
Okay, thank you.
Dr. Shukla.
I don't think that was a mistake. Sorry about that.
All right, yeah, no worries. I just trying to make sure we get all the questions answered.
Thanks for all the information.
Again, we will be distributing slides. There will be a recording posted as well, so you can revisit us. And we are very open to answering questions via email as well, setting up additional conversations if we need to as well. Oscar, good to see you. Oscar, you go ahead and ask your question. Maybe having trouble popping off mute. In terms of specific emails, the emails listed in the there are multiple emails listed in the proposal that could come to me, etranby@carequest.org, our program manager, Rebecca Preston, or the analytics@carequest.org email. I'll get you to be able to answer the questions.
Eric.
Hey, there you go, Oscar. How you doing?
Hi. Question for the dental claims data. Do you have that information specific to the state level? So could I make comparison for Florida, Kentucky, New York?
Yep, correct.
Okay, great. Thanks.
Any other questions? Guys, it kept me on my toes today. Let me go through the open. Oh, details about the data again, list of variables, et cetera. You can look up so yes, we'll be able to share with more direct email. Sample size ahead of the proposal. So sample sizes are listed out. Broad sample sizes are listed out in the within the call for proposals. Specific sample sizes for subpopulations, et cetera. Given our claims data is in the millions of records and tens of millions of records. Sample size is rarely an issue for the kinds of work that we do. At this time, I would not consider sample size to be a broad limitation if you're planning on using the claims data resources. Dr. Shukla.
I don't have any other questions. I'm not sure.
Oh, it just keeps popping up and on. No worries.
I'm so sorry.
No, I'll stop calling on you. Have to take yourself off mute.
Thank you. Thanks.
Anything else, Sodia? Do you have another question?
Yeah, you said the lines that you have for research, integrated medical and dental, healthcare, analytical, and is there any point or any subject or any disease that you have more interest in this year? Because from some years ago we had COVID and now we don't have so much, but is there anything that's more important for questions
I would want
that will receive more attention than others?
Is a great question, but it's not one that I'm going to answer. There are certainly things that we are more interested or less interested organizationally, but those shouldn't drive the research here. For me, it's questions that sit at the core of medical, dental, behavioral, or pharmacy interaction and the way in which those interact. So we talked about that kind of that MDI or kind of health equity questions. Beyond that, we don't have particular. There is nothing that says if you study this disease group versus another, you're going to be pushed to the head of the line or kind of left off within our proposals. It is much more about making the case about where the science is and what the unique questions you're going to be able to answer.
Thank you.
Yeah.
Thanks very much.
Yeah.
Thanks very much.
Anything else? Sherry Beth.
Sorry, I just thought about, because you mentioned behavioral, I was just wondering to what extent behavioral data are included or whether there are those restricted data sets. I mean, just basically after diagnosis, if depression data, anxiety data, substance use are all also included?
So if they're part of kind of traditional claims data sets, so things that would be submitted for reimbursement, we have those. So we have diagnosis codes, number of visits, et cetera. What we do not have, what we don't have extensively in the data sets that we're using for this proposal would be answers to something like a PHQ-9 or a particular outside of a diagnosis of, a depressive disorder, for example. So we'd have the diagnosis of the disorder, we'd have the visit that they had. What we would not have is things like notes from the visit or a score on like a PHQ-9 test, for example. Other questions? All right, hearing none, I'm gonna, and kind of seeing no additional open questions in the chat. I think hopefully we've covered your questions. Again, please review the RFP. We will send slides for all those registered, as well as the proposal is out there. Email any questions that you continue to have. We will answer them to the best of our ability. If you are planning, very happy to receive all the proposals that we receive, and we'll work to answer all the questions in a timely manner. So with that, thank you everybody for attending the call today. I hope you have a great weekend, and we look forward to receiving your proposals. Thanks, everybody.